So, we're extremely excited about the numbers that we're releasing today in the Care Innovation Frontiers report. What we'd like to do with this panel is to explore where organizations are actually focusing on the caregivers. What I'm excited about is the three organizations that we have on stage here are, I would say, front runners and visionaries in looking at the caregiver before we even released a report saying that there was something in the order of $270 billion to be made over the next 5 years, while serving the needs and improving the quality of life of caregivers and the people for which they give this care. So, exciting panel. I would like each of you to kind of introduce yourselves, your organization, what you're doing with caregiving right now, and what brought you into this and think about this space. So David, do you want to kick us off?
Sure, thanks, Jeff. I'm David Inns, I'm the CEO of GreatCall. GreatCall is a company that for 10 years we've been focused on providing technology and services to help older consumers stay active and independent longer. In that 10 years, actually, we've grown the company to over 900,000 active customers and over 1,000 employees now, providing a wide range of services, whether it's communication and social engagement or medication adherence or brain games for mental acuity, right through to emergency response. And then we got involved with family caregivers after realizing how involved they were in both the purchase of some of these tools for independence as well as the influencing of them. So basically what we do is we take all of the information in our devices and our services and we analyze that data and present that data back to family caregivers in an app that just allows them to know how their parent or their family member is doing, if they're sticking to their routines and if they're just staying active and encouraging them along the way.
Great. We'll delve into that, but
okay.
Here, please.
I'm Vidya Raman-Tangella. I head innovation, have the distinct privilege and honor of heading innovation for UnitedHealthcare, an organization that I've been with for the last 5 years. What my team and I focus on is essentially designing and developing forward-looking and innovative solutions to ongoing needs, unmet needs, perhaps new needs. And we do that through a combination of functions. First and foremost, human-centered design, that I think was mentioned a few times this morning, which helps us understand that outside-in perspective. So how do you live in the shoes of a caregiver? How do you speak to them? How do you have them sort of describe the need and opportunity? And then the second function that we have is experimentation. So based on the insights, and if we want to create something innovative, we put out innovation experiments that help us test the concept, help us hone in on the need, help us do things better and evolve. Thirdly, a function that helps scale successful innovations. That is essentially what my team and I do. With respect to caregiving, it was one of those, we constantly scan the external environment and, look for trends, futuristic trends, but also, what's working and what's not working. At the same time, we look inwards and we said, okay, where are some unmet needs? When we spoke to caregivers using human-centered design, we just unraveled this very complex and vast need. And when, we thought we understood what it was, but it actually was a lot more complicated. It was very fragmented. It was a very daunting experience for people to be in. And so what we decided to do as a team was create an experiment that essentially would be all about the caregiver. And so we created an end-to-end holistic solution, starting with holding hands for with that caregiver, deepening the understanding of their unique need, providing very tailored guidance and information that is necessary for them, onwards to sort of creating a marketplace of products and services that they could procure in order to take care of their loved one, onto connectivity and an ecosystem of support. So a lot of people are in this alone and they don't know who to turn to. So we created that connective ecosystem which helps them sort of connect with others in providing care, share messages, share documents, divide up tasks, know what's coming, and so on and so forth. So that's essentially what we created in the form of an experiment about 2 years ago, launched it, and today that pilot is available to roughly 800,000 United members. And as I speak, we're in the throes of scaling and commercializing it to become that much bigger, that much broader, and evolve it to the next generation.
We'll come back to that as well. And finally, the Veep, Sanjay. Tell us what AARP is doing about caregiving.
Thank you. Thanks, Jeff. Thank you, Vidya. So my name is Sanjay Khurana. I work for AARP Services, which is a subsidiary of AARP, and I have been given the honor of actually bringing some of these products and services to market, really trying to scale a business and try to get some consumer engagement. So it's a bit of a lofty goal here, but I'll get back to the approach, but really where I came from. So I used to work with Jeff and Jody in the thought leadership team. So I was fortunate enough to
amigo,
spend.
and now you're gone.
I know, how can I say?
We have Theo.
I moved on to better things. Ouch. So we spent the last 3 years really speaking to the market, speaking to the entrepreneurial and the investment community about putting the focus on the spotlight on the 50 plus and to some extent on the caregiving. And the goal really there was to get the private sector, which typically is laggard in serving the 50 plus demographic. I mean, no one will argue that because the numbers speak to themselves. So we focused a lot, mentoring a lot of companies, helping them in their design thinking, helping them in their empathy understanding of this demographic, showing them where the economic value is as a business, and some of those numbers that Jody referenced, we've done the same thing for health. So having done those three years of sort of market outreach, we had sort of primed the pump. I think we had spoken enough to the marketplace to say, look, you'd be stupid not to look at this big opportunity. And Jody loves to say that. It's a very large opportunity. It's over a $7 trillion opportunity when it comes to all consumer spend in 50 plus products and services. 30 billion is spent in health out of pocket. And now we're saying by 2020, 72 billion is going to be spent in caregiving. So given what the market reacts to is economics. And so does investors and so do entrepreneurs. So I felt like having done a lot of speaking to the market, this was sort of time to finish the other half, which is really help some of these products and services get to market, find really the right experience to serve this unmet need, finding the caregiver, serving the caregiver the right experience, and really helping that message come back to the market and say, what have you learned? What's missing, and kind of create this virtuous cycle of we have to give back to the market guidance based on what we learn in the market.
So let me stop you there. So caregivers often don't even know they're providing care. It's just something that they do, something they're doing as a family member or a neighbor or a friend. So in each of your organizations, how do you find these people and then let them know that these products and services that you're building may be available to them and help improve their quality of life, both for themselves in terms of stress management, but also the quality of care that they're delivering? So let's start with David.
Well, it's definitely really difficult still. So it's not easy because they're not self-identifying, because it's a nascent market. If you go and look at the statistics of how many people type in caregiving tools into Google each day, you will find that it's a pretty small number compared to any category. Baby monitors, that's one I always like to compare to because, I think it's like 400 times the number of searches for baby monitors. So, so it's still really nascent. So mass advertising isn't going to work because you're going to put that message out there and nobody's going to respond to it. So I always say the caregiver, the way it works is one day they're not a caregiver, and then the next day they wake up and they're a caregiver. Sure. And so what you have to think of is what actually happened between that time where they weren't a caregiver and they were a caregiver. What were the events that took place? And what is that caregiver going to do from that moment they realize they're a caregiver? What are they going to do? What are they going to research? Where are they going to go? What are they going to look for? And your message has to be there at that point in time. But I can't tell you some of the details because otherwise I'd be giving away my secrets.
Well, I'm all about secret
He's already
sharing,
over here
yeah.
trying to create as much competition for me. Just
How does United, I mean, because United has an interesting role too, and I want to ask you, when you mention those 800,000 people, are those lives that are covered as employees, as caregivers, or are you guys focusing on the care recipients? Because this is a two-pronged equation here.
No, that's a great question. So, I mean, I'd agree with David that it's not easy, and I think this is something that we're going to strive to do more of. United is in a unique spot of interacting with members on an ongoing basis, be it for clinical programs, customer service, right? And the other thing I would agree with is that nobody labels themselves a caregiver. I mean, my husband and I were in the situation 2014, most of 2014. I don't think my husband ever called himself a caregiver. He was still that son who was taking care of his mother and perhaps going out of his way to do so. So what we are trying to do is in plain, simple English, ask people if they are taking care, if they think that they will be taking care of a loved one. And on the flip side, with our Medicare Advantage members, the more senior population, we ask them if there is somebody providing care for them. And almost 1 in 5 of our Medicare Advantage members identify somebody that is providing care for them, and that is their authorized representative to deal with, that interacts with the health plan in an ongoing manner. But what we're trying to do is to say, okay, what are the other touch points? What about, when somebody is discharged from a hospital, a point of care, working with physicians, because they're an important part of this ecosystem. And how do we sort of bring them into the fold and enhance that net that we can cast to identify caregivers?
So before we go to Sanjay, because you already threw me under the bus, but so
You're cut off now.
I think I know the answer, but explain to me the motivations for United to be worrying about this other constituency that may not be the person that's covered by the actual plan, may not be the actual member.
So our mission is to help people live healthier lives. Health is not just the absence of disease, it's well-being, right? And we heard from Terry, we heard from Jody. It isn't about somebody providing care, it's about what is happening to them and their health and so on and so forth, right? And then the other thing that we also realized is that caregiving is an extremely personal journey, much like poverty, much like trying to lose weight. And it's a very unique journey. So what we are trying to say, well, if we want to help people live healthier lives, let's look at the entire ecosystem of health and well-being. And that is really what is driving us. And I think we also realize that by taking care of the caregiver, we can do that good or that much better a job of actually taking care of that Medicare Advantage member and so on and so forth. So yeah, so we're trying many different ways to reach both the people receiving care as well as those that are providing care.
You're obviously going to reduce the healthcare cost of somebody if you've taken a family member that wasn't engaged in their well-being and get them engaged, even on a minor level. That's going to have a pretty significant impact on the resources that the senior might use outside of the family.
Yeah, I mean, I would equate it to lifestyle management. I mean, think about, losing weight, quitting smoking, and stress management, right? It's yes, there's you, but then there are others in that space. This, to me, is life stage management, and that's what's becoming increasingly apparent is that people need help, people need hand-holding, even to manage certain life stages, and they want the companionship. They want to be understood. They want that support to be that much more personalized.
I mean, it's another debate for another panel is, what costs money on one side is somebody else's business model and profit. And so after years of going to so many digital health conferences where we're going to reduce all the waste and all the money spent, somebody's losing pennies over that. But that's a whole nother topic. Sanjay, so how do you approach finding caregivers and where are they and how do you speak with them?
I think this is a philosophical discussion that I don't subscribe to because I think we can spend a lot of time trying to say how they identify themselves, and that's sort of immaterial because that's for the marketeers to figure out the right messaging. But I think really it's really to go back and say what really drives their motivation and finding them in the right journey. So you have to immerse yourself a little bit into their journey, and the other models of sales and targeting and engagement don't work in caregiving. You can't say, I got a widget, you got a need, let's match widget to need, because that change, as David said, changes from day to day. It's very cyclical, it's very episodic, and it is a very challenging thing. I think I would say if anybody else, Amazon probably is best equipped to figure it out because they have a pulse on your buying behavior, if only they could get down to that emotional connection. So I think what we step back and we looked at, we understand the gaps in the market, and we can talk about where the societal gaps are in the market. But that really doesn't help us as much because I think it is about really understanding how to serve the caregivers. What we have decided to do is step back and take a position that we really don't understand caregiving. We don't understand the caregiver's psychographic and their emotional journey. So let's start.
AARP just said that they didn't understand something about aging. This is a big shift in
I think,
culture
but
for AARP.
that humble position is better because from there on you can learn more. So we started with that saying we don't know. Let's not bring products and services to the market unless we really understand what they need. And we went through a fair amount of consumer journeys. We did a lot of co-creation, and we came away with some really simple takeaways. And that really helped us pivot our thinking and evolve our thinking that A, we don't know what we don't know. Let's start with that. Second, let's figure out what is it that they need and what drives them to come to a marketplace or some place where they are looking for help. And third thing is speak to them in the dignified fashion that they deserve. Most of the market has got wrong on all of these three. Sorry to say that, David, but I think we are pushing.
You didn't include us, clearly.
I think what we learned was we develop for them wrong. I think we have to step back and we have to develop with them. The tech market does not treat them as co-developers. Social media, web technologies tend to have the concept of beta users where they throw spaghetti on the wall, users help them co-create. We don't do that for health and aging. We give them crap and expect them to buy it, right? Let's stop that. How do we bring them
Let's
into
stop that.
we got to bring them into the development co-creation. So that was one point we said is like, if we're going to do anything, first build a community of caregivers who can be active participants and be vested in the societal uplifting of this problem. That was one. Second one is create an environment where we serve their need. Don't push product. It failed. Consumers said, don't give me product. What I really need, surprising, they said, first I want connection to community. I want a safe place where I can connect with peers who I can share my experiences with, whether if it's at a disease state level or an emotional level or at a local level. I just want to find somebody who lives in my zip code that I can go offline, connect me so I can go have coffee and I can share my experience. So they want connectivity first to peers, connectivity to experts. As Vidya said, they want to talk to clinical staff or a social worker to get them over that emotional hurdle that they have when they come to the site. Once you've addressed those two really soft needs, then they're interested in learning what are the tools that they can embed into their life that gets them to reducing burden or reducing stress or solving or giving them back time. And giving back time should be the business ROI for every company. What can you do to give back time? So those are the kind of learnings we got.
I was just going to say there's a really big piece missing. Since you threw me on the bus, I'm going. No, there's a big piece missing there because in that entire thing that you talked about, it was all about the caregiver. And we can't just talk about the caregiver because we'll end up with wrong products and services again. Because the caregiver is doing something very important. They're the family caregiver for the older consumer.
Right.
And so that has to be part of the equation. So instead of just working with caregivers, what we do in our company is we actually bring in both the family caregiver and the older consumer and sit them in rooms and actually do the interviewing and understand, because it's a balance and it's a negotiation between what's a violation of privacy versus what's something that's helpful. What's something that, what's the goal that the older consumer is going to receive or the benefit they're going to receive from the product or service that they're going to sign up for. Because if they don't have a benefit, I'll tell you exactly what the technology is going to do, right? It's going to be like into the door, done.
Yep,
there has to be a benefit for both the older consumer and the caregiver for any of the products to work in this environment.
And so I just want to take one. I think I would actually agree with David on that. I would say GreatCall is probably one of the few companies that have had a legacy and DNA in actually getting the experience right, because they spend a phenomenal amount of effort in understanding the consumers, right? Understanding that experience and getting co-creation. And I would say it is very important to get that three-way sort of experience right. And that same logic is true of supply-demand matching. In order to improve the demand, you really should focus more on the supply side as well, right? And that's what you're saying is, if we don't understand both aspects, you're really building a, half-assed product.
So it's a complicated thing, and so and I'm going to throw this out. I'm thinking live without a net, but there seems to be like there's three buckets you can look at. There's solutions that the caregivers use that perhaps the care recipient doesn't even know exist. Shared calendaring, those sorts of things that no one knows. There's solutions that the two parties share together. They make a purchasing decision. They're both interacting with it, and then perhaps there's a third category where it's stuff that the care recipient's using that maybe only behind the scenes pings back to the care provider. So where do you focus, and how do you figure that out? That's like it's a big spectrum. That's three different markets. Do you want to start?
Well, I mean, I would say all of the above. I don't think, and I think that's probably the part of the problem we have today is that we have silos of solutions. Some doing a phenomenal job in the space that they are in, but what we need is a well-knitted together end-to-end solution. So if you put, whether it's the caregiver or the care recipient in the middle, do they want to be interacting with 30, 40 different things? Do they want to know this is mine, this is yours? No. I think they just want to know that when a situation arises, there is this end-to-end sort of integrated system. And I don't think it's just technology and products, it's also services that go along with it. Mm-hmm. So, I mean, that's one of the things I look at is that a single technology or a product is not going to solve anything. It is going to take a composite, it is going to take good integration, it is going to take that service, and to Sanjay's point, bring in that input from that caregiver, from the care recipient, and let's sort of design it for them. So I would say It's all of the above. And I think if we do this right, those boundaries should blur. Nobody who's experiencing that situation should be able to say, okay, this is for me as a recipient and that for you as a caregiver. I think it's just part of how we manage our lives. So.
David, how do you explain this to your board? How do you break these segments up and explain it to the folks that are supporting you? What's your opinion?
How do I explain it to my board? You know, basically that we're going to be generating revenue by providing services. So we actually don't even sell to caregivers, right? We actually sell the solutions to the older consumer, and then we offer the tools for the caregiver free so that they basically are influencing the decision by our tools for the older consumer. So for me, it's all about, you know, sales and revenue generation and profit generation from the products and services we do. But I was going to say, you know, to bring it back to your question and bring it back to your research, I was looking at it backwards from behind the screen, so I didn't really get the gist of it. But it looked like most of the largest categories were about opportunities in connected health and bringing back that information. So that is going to require a connectivity with the older consumer. So I would say, I think that, you know, really a key part of this is going to be connectivity and benefit to the older consumer for getting that information back into the system.
Agreed.
So again, I'll take the position that we don't know what we don't know. What we have been.
Well, when are you going to know?
Well, yeah. Well, consumers will tell us. I think this is where we got to be patient, because if you were to
That's
say.
That's not what I say to the board.
What you don't want to go say is, like, our rear view mirror view tells us that personal safety security products is the most important. I say probably not, because that's what we have had some reasonable traction, but that's not maybe what the need is. So we are going to go into bringing services and products with our best judgment, but that's not always going to be the answer. We know that consumers say they want access to experts. So let's take it down.
Yeah.
We know they want access to community. Start with that. But where we know where they spend the biggest stress and time is around activities of daily living. We know this, that may not be their ultimate need, but that's what consumes them today. So can you give back time by bringing simple services such as meal delivery, transportation, you know, things that are actually coming not from the health side, but more from the shared economy space. You know, access to in-home care services. As Jody mentioned, that is the largest opportunity. If you can provide them a good model for a trusted quality control in-home care professional to come in and take care of mom for things of companionship or, you know, getting them dressed or cooking, that relieves a lot of the pressure from the caregiver. Once you've created that little bit of a space for them, that's when you think about health, okay? Because they can't think about health because they're dealing with such, you know, issues in their face. Health is a big issue. Safety comes in after that. And I think there is no one sequence. There's going to be many things. So you have to try a lot. To Vidya's point, you got to experiment. And then you'll actually figure out what they want. And don't forget, because there's also longer term things that people don't necessarily naturally look for, such as financial planning, life transition. Those hit them later. So don't ignore those, but those may not be one. If you ask any consumer, you want financial planning product, they go, I'll deal with it later. I'll call my friend, or I'll call, you know, a planner, but they never think about it. So there is the spectrum of short term to long term. And I say the only way to do this is test and learn.
So, I mean, to add to what Sanjay said, every caregiving situation is unique. So I think we at the back end, as suppliers of products and services, need to be able to serve them in many different ways, but do not give it to them unless the situation is properly understood. Because somebody might need financial help, but the next person may not need that financial help. And so I think it's more about, again, always viewing it from that unique situation standpoint and then saying, okay, how do we take what we can do and bring it to those individuals so that we can truly support both the recipient as well as the giver of care. I also think that as time evolves, and hopefully we'll see this, is that all of this becomes more proactive and much more upstream. So as opposed to waiting till a need arises and then scrambling to put things together, how do we talk to people? We're all going to be in the situation of providing care, let's face it, right? How do we, knowing what we know today, anticipate some of those needs, plan, prepare, and work with, much like we do financial planning, much like we plan around our children, right? And so I think it needs to come into that mode with time, and that's probably when we'll, sort of solve many pieces of the puzzle.
Scaled and sizable organization. Where do you guys see the opportunity to work with smaller, more lean, more innovative, not saying you're not innovative, but different sorts of organizations? And where do you see the gaps in the marketplace that maybe might be filled by entrepreneurs and that sort of thing?
That's a great question. When I look at, if you don't have the capital or the wherewithal to get the capital to try to grow a consumer business, which takes a lot of money, or to scale a service organization, which also takes a lot of money, to be able to serve a million customers takes a pretty intense amount of resources, then really licensing is probably the best way to go, right? Where if you're developing interesting technology, so we are always scanning the marketplace and looking for people to provide technology to us. So like our fall detection technology, we license from a smaller company called Biosensics. And our brain games that we integrate into all our products, we license from Posit Science. So we're always looking for licensing opportunities, and I think that would be where I'd say if you don't want to go for the $40 million necessity rounds, then you can focus on the licensing opportunities.
Great.
I would say, no different. So I think there's plenty of opportunity, right? So if the focus were that deep personalization and relevance to a certain caregiving situation and actually solving end-to-end, I think companies that are in the space of providing products and services, those in the space of leveraging data, technology, connectivity, I think they all have a huge role to play. And I think what I would say to the startups is think beyond your technology and product. It isn't one that is going to solve everything. So what are the other pieces? To your point, if you're licensing, it's because you see the need for multiple pieces of the puzzle. So think beyond that. Ask who else needs to be at the table. So I think it's more a collaborative approach that is going to probably successfully solve this, as opposed to any one organization saying, yep, we know it all and we can do it all.
Great stuff. Sanjay?
So where I sit at, I see so much dependency on the market's innovation for us to be successful. So as a service organization, as a social mission, we really rely on market innovation to help us succeed in our mission. So I work very closely with a lot of startups from small to large and try to help them shape their product for the needs of caregivers. So the value we bring is really connecting technology to really relevance. And in many cases, we have actually tried to make these products a lot more caregiving centric because as you guys probably know, everybody who develops for digital health is probably developing for payer or employer channels or provider channels. They're not thinking out-of-pocket caregiver experience, and they don't even think that there's a caregiver in the solution. They're always building it for a doctor or a administration, right? So we have helped a lot of companies in that sense think about taking their products, whether if it is a telehealth product or if it's a social engagement product, and to really try to help shape it for caregiving. So we see a lot of opportunity to help shape. Hopefully, we would think that over a period of time, there's a lot more education from the work that Jeff and Jody do, is coaching companies to say, think about not just one need that your product delivers, but understand how it fits into the larger need, and think about a three-way experience, because it's not about the caregiver, it's about the care recipient. How do you connect that experience? And still, don't forget one thing to all startups. Build a user experience that really shows dignity and gives them the user experience. As much as you as a tech user want a good experience, they deserve the same. Don't give them crappy user experience just because you feel they're an older population. So I would say this is a good time for market innovation to actually look at how do you take your products to market through organizations like David, through United, through us, and we'd be happy to share all the research that we have put together just so that you have a better understanding of what the need states are.
Mm-hmm. So Jill proclaimed 2016 as the year of the empowered caregiver. So you just gave some suggestions. We have 39 seconds left. Go. Give something provocative, tweetable.
So think more upstream. Help somebody that will be in a caregiving situation anticipate, plan, and prepare, like I said before. The other thing that I would say is that there are models of care and caregiving elsewhere in this world that are working well. I mean, in a lot of cultures and societies, caregiving is the norm. Aging in place is the norm. And somehow people are transitioning very smoothly. It's not disruptive. It's definitely challenging, but it's not disruptive. So what can we learn from those countries, from other cultures that we can bring in here and then create in the form of a service or look at it in the form of a technology?
Good stuff. David,
I would
last word.
Yeah, the last word. Oh, one word?
Yes.
Okay. No, I think this really is going to be the year over the next 12 to 24 months, thanks to a lot of the work that you're doing at AARP, actually, really bringing family caregiver awareness forward, making a big deal of it so that people are going to start talking about it, and that's the first step, because as soon as people start talking about it using the same language, then they're going to be self-identified, then they're going to start looking for products. So I see that that is really going to start happening over the next 24 months.
Jody, did you hear, Terry, did you hear that? Because my review's in a couple of months. So. All right. Great. I'd like to thank our awesome panelists. This
Yes,
has been a fun
amazing.
time.
Thanks.
Thank you, thank you.